Measuring for Anti Swan Neck splints, PIP joint. When measuring for the PIP joint, hold the sizer into the joint crease and bring the top of the sizer down proximally so that it is approximately mid-phalanx and at a 45-degree angle. Don't worry if the ring sizer does not fit snugly against the surface of the entire finger. Choose a size that is the correct length and position on the finger. Repeat the process and take the measurement distal to the joint. Once you have the correct size determined, double-check by also trying one size larger and one size smaller. Write the digit, style, and sizes on your order form. Note that the distal size is usually smaller, but not always. Once the measurements are complete, you will need to trace the digit on the tracing page of the order form. Use a pencil with a long lead to ensure an accurate tracing of the digit. On the tracing, mark the joint creases as they appear on the skin, and mark the location of the nail bed. Indicate the location at which the measurements were taken so that the length of the finished splint is accurate. Indicate the digit, date, and patient's name on the tracing page as well. Please make sure the lines and markings of your tracing are well defined, so when faxed or emailed, they can be seen clearly. Measuring for Anti Swan Neck splints, DIP joint. For Anti Swan Neck splints for the DIP or IP joint, measure in the same way as for the PIP joint and be sure to include a tracing. Before measuring, determine if the patient prefers the ring to rest on the nail bed or just below it. DIP anti-swan neck splints are designed to sit with the distal ring distal on the nail, distal to the half moon. However, some patients prefer to have it below the nail. Note that it is not unusual for the proximal and distal measurements to be the same. Measuring for anti-swan neck splints with sidebars. Measurements for anti-swan neck splints with sidebars are taken in the same way as for regular anti-swan neck splints. But please note that an accurate dorsal tracing of the digit is particularly important when ordering splints with sidebars, as limited adjustments are possible once made. On the tracing, be sure to indicate the location at which the measurements were taken so that the length of the finished splint is accurate. If you are ordering an anti-swan neck splint with a unilateral sidebar, indicate whether the bar should be located on the radial or ulnar side. Measuring for reverse anti-swan neck splints. To measure for a reverse anti-swan neck splint, ensure the finger is in the corrected position and hold the sizer on the dorsum of the finger. Angle the sizer at a 45-degree angle so that it sits approximately mid-phalanx on the palmar surface. To make a lateral tracing of the digit for a reverse anti-swan neck splint, have the patient hold the ulnar side of their digit between the order form tracing page and a firm surface. Hold the digit in the corrected position and carefully trace around it. Again, mark the joint creases as they appear on the skin and mark the location of the nail bed. Also, please make sure the lines and markings of your tracing are well defined, so when faxed or emailed, they can be seen clearly. Note that reverse anti-swan neck splints for the DIP joint are designed so that the underside of the ring will rest on the pad of the finger, which may have functional implications.